Good evening, everyone, and welcome to the Ramaz Alumni Virtual Campus, the Doctor in COVID and Education. We begin tonight's Zoom as we have each of our courses of the evening with a prayer for all those who are ill during this difficult period of time. We wish them a refuah shlema, and to all those that have lost loved ones, we wish them comfort and condolences, and we pray that as a community we can remain strong together. We also continue to be thankful for all of our frontline heroes in the medical and other professions who continue to do God's work. Thank you for the work that you do each day, and please stay strong and healthy. And now to tonight's program. The Doctor is in COVID and Education. The discussion this evening will be centered around COVID-19 and the education system and the importance of a harm reduction model and how to keep your family safe during this time period. We are very, very privileged to have tonight with us Dr. Sarah Schlesinger Hirschfeld. She is the Associate Professor of Clinical Investigations at the Rockefeller University and the Chair of the Institutional Review Board and a Senior Physician at the Rockefeller University Hospital. To us, she continues to be the most noted mother of Jacob Hirschfeld and the wife of Ellie Hirschfeld. We are also very privileged to have with us a very proud alumni of Ramaz, Dr. Jason Perlman. He is from the class of 93, a lifer, a Ramaz lifer, as we like to say. He is a pediatric infectious disease specialist. After graduating from the University of Michigan, he went on to Sackler School of Medicine and did a pediatric residency and then a fellowship in pediatric infectious disease at St. Jude's Children's Hospital. He currently practices in Park Slope and Crown Heights and lives in the Bay Ridge, Brooklyn area, and also has a wonderful son, a son just as the same name of Jacob. So, and Jason has advised Ramaz over the years in the infectious disease areas and has been a really tremendous asset to us. So this was a wonderful opportunity to have him join us tonight. As our moderator, we have Jonathan Cannon, our current head of school and someone who has been involved in Jewish Day School leadership for over 3 decades. Jonathan Cannon has taken our school far forward and specifically during this difficult period has led Ramaz in a calm, thoughtful, and wise manner. So we are so pleased that he will be the moderator of this evening's talk, and we thank everyone who has joined us on the call tonight for being with us. I will remind you that at the bottom of your screens there is a Q&A button. That is the means by which you can share your thoughts and questions. We're happy to try to get to as many of them as possible. We ask that the direction of the questions not be personal in nature, to remind you that if there are specific personal questions and things having to do with your own medical issues, it is best to consult your own physician. This evening is really very much communal and geared in that direction. So again, please use the Q&A button at the bottom of your screen. Thank you for being with us this evening. I'll now hand it over to Jonathan Cannon, head of school and our moderator for the evening. Thank you.
It's a good start. I'm muted. Okay. Good evening, and thank you all for joining us this evening. It's wonderful to see so many people, and I'm really honoured with to be part of this and to be able to moderate with our guests. I learn from them every time I hear them speak or have individual conversations with them, and both have been very gracious with supporting the school and the local synagogues in terms of thoughts and guidance, and we're learning as we go, and it's the learning from experts which help inform decisions that we're making. So whereas tonight is not about decisions that we're making, it's a wonderful opportunity to hear from the people who have the expertise that is inputting into that process. And opportunity for people to ask questions, not specifics about what's going to happen this day or that day, but what are the kind of factors that they're seeing that influence these decisions. And the format of the evening is I'm just going to invite Dr. Schlesinger, Hirschfeld, and Dr. Perlman to say a few introductory comments, and we want to dedicate as much of the evening as possible to answering your questions, because your questions are what we really want to, that dictates the information that we want to be sharing. So it's my pleasure to invite Dr. Schlesinger Hirschfeld to open with a few thoughts.
Thank you, Jonathan. I'm honored again to be here. Some of you know I've done a few of these calls or Zoom presentations for the Shul, and this one is different because, as Kenny so graciously not alluded to but described, I'm a physician scientist, and I've spent my life working on antiviral vaccines and how the human immune system fights viruses. So a topic that was of very little interest to anybody is now of great interest to very many people. And I'm delighted to be able to help as I can. And I like to say I like to stay in my lane with what I know. But I'm also not only Jacob Hirschfeld's mom, but I'm the mom of 4 older boys, Joshua, Zachary, Daniel, and Joseph Frankel, who all went to the Charles E. Smith Jewish Day School, where Mr. Cannon was in charge. And when he came back, I was just delighted because he had done a wonderful job there. I think you don't look any different, but a fair amount of time has passed since those boys are now from 25 to 32. And thank God they're all thriving and not too far away, though I haven't been able to see them really. But so I am first and foremost a mother, and I'm an experienced mother. And this whole situation is just a disaster for us. The school did a wonderful job with distance learning, but as Jacob liked to say, Zoom school is like regular school, but without the fun. And I felt like my Zoom work is about the same. And, the teachers were wonderful, but there's just nothing like being together with their friends and their teachers to learn at every age, from the ECC all the way to the high school. So there's no question that I, feel in my bones the need to get back to school. With that said, when I put on my other hat, we are in the middle of an event like we will probably, none of us will ever experience again. This is a worldwide pandemic. We are fighting a virus that 7 months ago was unknown to any scientist. So that's just like a crazy thing, right? It's all new. And none of us have immunity to it. So I keep reminding myself and my adult children and my adult stepchildren, who are like my own children, that this too shall pass. This epidemic will be over, but it's not over yet. And we are in the thick of it. And we are learning new things every day. So whatever this coming year is going to look like, it's going to look like no other year any of us or our children will ever have experienced. And we're going to have to understand and tolerate a level of uncertainty that is uncomfortable and frankly even painful for mothers like me. And I've been so impressed, frankly, Jonathan, how the school is really trying to incorporate the best scientific information. But I think if anybody wants an example of what we know and don't know, the first Zoom I did, nobody here could go to Florida. If you went to Florida from New York, you had to be quarantined because 1 in 5 New Yorkers was infected with COVID, and there was barely any in Florida, and they didn't want us there. Well, on this now, it's exactly the reverse. Nobody would have predicted that, least of all me. And so the things that are happening, particularly in the southern part of the country, are tragic. But we're learning a lot from them. How the virus spread, who spreads the virus, what prevents it, what doesn't, are all becoming, we're truly learning new information every day. So I think we just have to tolerate a level of uncertainty and maintain a level of flexibility always. And, I wake up in the morning and I say to myself what I keep saying to everybody else, this too shall pass. So with that, thank you very much, Kenny. Thank you very much, Jonathan and Jason. I turn it over to you.
Thank you very much. And just as I hand over to Perlman, just to remind you that if you want to use the Q&A to put in questions as you're listening, you're invited to do so. Dr. Perlman.
Hi, thank you for having me. It's a pleasure to be here. Old bombs never die, thank God. So I'd like to just comment on how in this unknown period, since this is all new, we have to do our best to minimize our risk. There's no panacea. There's no one shield we can wear, and doing each little prevention and having societal responsibility to maintain doing those preventions are really going to help in limiting the spread from person to person. So as far as our children, getting them back to school, we all want to do that. The AAP says it's a good idea. We have to see what form that takes. The best thing to do is to do what's called a harm reduction model, and you're going to wear your mask, you're going to socially distance, you're going to wash your hands, and you're going to really follow the limiting factors to decrease the overall risk to the minimum it can be. Something else we'd like to do is to remind everybody to get their children immunized for their usual vaccine schedule. The American Academy of Pediatrics also is concerned that vaccination rates have been falling, and we've already seen that a measles epidemic happened last year without a pandemic. So the importance of preventing whooping cough or measles or diphtheria from coming back is as important as ever. I share a lot of the thoughts expressed by Dr. Hirschfeld, so I'll just respectfully say thank you.
So I would just like to add to what Jason said, and I agree completely with everything he said. But there is no way that we can emphasize enough how important it is to keep up with current vaccinations, and particularly with the flu vaccine come the fall. Because one of the things that everybody's worrying about is what's going to happen with this virus when it's compounded by the normal seasonal influenza. And frankly, there was just a paper out today that there's a new swine flu coming out of China, and how serious that threat that's going to present, we don't know. It truly just came out today. But what we do know is seasonal flu vaccination is always a challenge, and this year it's going to be even more of a challenge, and we really have to rise to that challenge, both not to overwhelm the healthcare system, but so you don't end up, your kids don't end up really sick. Remember, I think last year 45,000 Americans died of flu, and the year before 60,000. That's a lot of people every year. And I think, you know, vaccine preventable diseases, we kind of forget about them, but if we don't vaccinate, they'll come right back.
Thanks. And so maybe the first question to you, sir, it's a very seasonal question, I think, as we go into the summer. Is it safe to be in a swimming pool, to swim in the ocean?
Jason, do you want to
Sure,
take it?
yes. I think it's great to try to do everything you can to stay busy. Mental health is a very important part of physical health, and to go swimming is a great thing in the summer. Ideally, you want to socially distance. No masks, of course. You're going to be in water, but you want to limit your exposure to other people. The water itself, the pool water, the ocean water, the lake water, that's probably not a risk, really. But the risk comes from not socially distancing and using that prime strategy, which we keep touching upon even early in this broadcast.
Yeah, I would add, the risk is not from the pool or the lake, it's from the people in it and the people you're going to contact on the way in and on the way out. So, you know, the risk in the locker room, as you enter, all of those places, you know, it's particularly important to be vigilant about masks, as hard as that is outside. But one of the things that I think is I find a little bit reassuring for these sorts of activities is being outside seems to provide a level of protection. It's not clear exactly how much, but inside is clearly worse. And I think that not just the swimming and the in the ocean and the pool, but being outside in general while we can is a terrific thing for everybody. And, we should all make the effort to do that.
Thank you. And I guess on that, talking about outside, are there things, I don't even, is there a difference, say, between having an open window, a closed window in your apartment or in the place that you're at? Is it out, everything inside is one thing, everything outside is another thing? How does that play?
So if I can take this one, because this is something that I have been following with great, and Jason, please add, but opening a window makes a huge difference. Light and air have been known since the time of Hippocrates and the time of Maimonides to be really good anti-infectives, and they really work. And even cracking a window makes a huge difference. Having a window wide open is the best thing. And if you're fortunate enough to be in a place where you can have cross ventilation, that's terrific. Air conditioning systems seem to be a huge problem. And there have been several reports, very well documented reports, of how the virus is spread, particularly in restaurants where people are sitting unmasked for a period of time and the air flows and it carries the virus, the air flows and carries the virus to the next table. So I think that the old traditional open window, open screen door, that this summer, the more you can do that, the better. And the more you can do that, even when it gets cold, will be the better. And it's interesting to me because I always say to my husband, you never know what's good. And everybody's been, making these buildings where you can't even open a window. And I think that's really going to be a huge problem. And as we open school, when we were talking before this, I asked how many of the windows in school can be open, because I think that's going to be a huge help from, in this harm reduction strategy of reducing the risk of infection.
Thank you. So, Dr. Perlman, maybe this is a question for you. There's been a lot written about that children are not as strongly impacted by coronavirus, and may even be possible that they're not as significant in the spread of coronavirus as people may have thought. And A, is that accurate? And B, if there's any accuracy to it, does it affect decisions that should be made about children and schools or camps or clubs or anything else?
Okay. That's a lot. So children numerically, they're not the people filling the hospital beds. Demographically, those are the pediatric beds were actually turned over to medical beds when we were hit hardest here in the tri-state area. That doesn't mean they're not carriers. That doesn't mean they don't get it and have some subclinical infection or mild respiratory infection or fever. That doesn't then take it to their loved ones at home, to their parents, to people who have medical conditions, to their grandparents, to the high-risk groups. As far as, I'm sorry, there was another question about that, about how to approach.
So really the question is, should that impact schools or clubs?
I think it's part of our responsibility as a community to look at the greater good. And that's something we hear a lot by some of the scientists trying to lead us through. It's whatever form school takes, it's really important to honestly and responsibly self-assess every day. Just like everyone gets temperature checks when they go somewhere to their doctor, it's no longer all right to say the kid is spiking a fever, here's 2 Tylenol, we'll see what this becomes. That child then goes to school, brings it to his classmates or her classmates, and then they then bring it home to their family members. And we know very well that children are vectors of spread in many, many outbreaks. So,
maybe Dr. Hirschfeld, and it may actually play into this, but there's actually been quite a few questions about antibodies and what are we learning about antibodies and how sure are we or aren't we that if you have the antibodies, it creates a layer of safety or otherwise for you?
So that's a wonderful question and a topic of great interest. So clearly there are people who get sick, recover, and have an antibody. And it doesn't appear to date that those people are getting sick again. It seems that they are what's called relatively protected for some period of time. There are also people who are getting sick, getting better, and don't have an antibody who aren't getting sick again. And those people may be being protected by the other part of the immune system called the T cell part of the immunity that we don't have a test for.
Got it.
There have been reports, and so you kind of have to say, how is this how are we learning this? Of people who've been highly exposed, like healthcare workers who got sick, got better, have an antibody, and then when they're tested routinely, because everybody's tested routinely in those settings, they're positive again for the virus. They're not sick again, but they have some virus in there, some virus is detected. So there are two explanations for that. And one is, there are probably many, but there are two that are sort of commonly held to probably be correct, that there's a little bit of virus left over that's dead and not meaningful, and that's what you're detecting. But there's another one that's much more concerning, and that is coronavirus as a group. So there are other coronaviruses, not this one, but ones that actually cause common colds. They're part of coronavirus A. This and SARS and MERS are part of coronavirus B group. There are coronavirus A viruses that after somebody's immune and has an antibody, they grow again in the nose and throat. They don't make the person who has them sick, but they can be spread that way. And so it may very well be that it's unlikely that somebody who's been sick, gotten better, and has an antibody will get sick again, at least in the short term. We don't know if that's 3 months, 6 months, a year, or longer, but they may still be able to spread the virus to others. So all of this is sort of a moving target, but the notion that had been proposed at the beginning, that there would be immunity passports, that people who had an antibody would then be immune and could go back to work and could sort of move in society with freedom. I don't think that people think that that's reasonable anymore, because I think too little is really understood about who is protected and then who's still capable of spreading the virus.
Thank you. And I think this question is actually for, I'd love you both to have a stab at it, although you might both choose to try and get the other person to have a stab at it and avoid it. But it's certainly a question from it's been put in by a number of people, and that is about the recent report from the American Academy of Pediatrics that seem to be at least pushing hard for physical school openings as soon as possible, ideally in September, and talking about the pluses and minuses on the health of the total health of students if school doesn't open. So I don't know if Jason, do you want to have the first crack at that one? And
I am really hoping school opens up. As a parent, as much as a pediatrician these days, I think socially, developmentally, emotionally, you need to be around your cohort and your friends and your commandants and have relationships that are different and outside of your family relationships. And look, people aren't going to the school they're going to read a textbook. They're going for the experience of being at that school with those teachers, with those children, with those mentors, in my opinion. How to balance the risk of exposing the larger community by grouping children together in buildings that windows may or may not be open, able to be opened? That's a really good question. I don't know that at this moment I can answer that question with the unknown trajectory of whether or not the first wave is going to hit around or continue at baseline, or if we're going to see a second wave as everyone congregates together again in the fall.
Thank you. And Sarah, and if you can add into your answer, just because Jason brought it up, any thoughts on the second wave as well? But the first part of the question is the American Academy of Pediatrics.
So I read that with great interest. And I think the way it was worded was a little bit deceptive, and it said, schools should open if it's safe. And there's no question that there is tremendous benefit to being in school. And you have to remember that those recommendations weren't just for our children who are in homes where there's enough food and their parents who can take care of them, but they're for, the whole of the country. So there are all kinds of social benefits at all levels to being in school. And, as a mother who works, nobody wants their kid back in school perhaps more than I do. With that said, I think we have to be very careful because what we can do safely is perhaps different because we're in an urban center. We have a building without a big campus. We can't put up tents. We can't put up, the temporary classrooms that I know are being done in other places. And I think that the guidance is thoughtful, but we have to consider the as safe part really, really stringently. And my own view is that I think there's going to have to be some sort of hybrid model where we give children, ideally give them some in-person contact. I don't think it's realistic to think we're going to return to what we had the beginning of last year. What I do think, though, is I take great comfort from thinking that probably next year, when there will be a vaccine or an effective treatment, we will be able to do that. So whatever we do this year is a temporary measure. And I think that we have to keep that in mind. With that said, I don't think we're talking about a second wave. We are still in the first wave. We in New York have managed to, go over the mountain, as it were. But if you look at the curves for the rest of the country, there's an uptick and then it's a plateau. So there is no end to this first wave. I mean, Dr. Fauci, for whom I have the utmost respect and who I know personally, testified before Congress yet today, that we're looking at, just an exponential growth in the number of people dying. Fortunately, it's not right here in our community, but we don't live in a vacuum. So I'm still worrying very much about the first wave. I think there is no doubt that this is a respiratory virus like influenza. And so when people congregate inside and we can't keep our windows open and we can't be outside, there will likely be an increase because people are closer together. But the good news is, unlike influenza, so in the 1918 pandemic, there was a huge change in the virus between April and October. And that's because the flu viruses do this really tricky thing where they switch out all their genes called antigenic shift. They also undergo what's called antigenic drift, which is what normal viruses or other viruses do. Coronavirus only undergoes antigenic drift. So there's a small amount of mutation, but there's no reason to expect a fundamentally different virus in the fall like there would be with influenza. So I think there will be an uptick again due to behavior, but I don't think there will be that tragic change in the virulence of the virus itself that we saw in the 1918 flu.
And I guess a question which leads on from that, or maybe it doesn't lead on, but I'm just adding it on. But I think it does. Which is somebody's asked about, given the really sort of tragic and hard hit that the tri-state area has taken, does that create any kind of herd immunity? Because there's probably many more kids with antibodies, and does that impact any decisions that ought to be taken?
That's a wonderful question, and I'm so glad whoever asked that. Thank you, because it was on my list and I forgot it. So herd immunity for any given virus, it depends on the virus, but it doesn't occur till at least 70 or 75% of people are immune, and that's on the low end. There are some viruses like measles that are extremely infectious where it has to be over 90% of the community to have herd immunity, which is part of the reason we've had the outbreaks we've had in the past year or two. Even if you extrapolate the highest numbers, no more than 20 or 25% of our population currently is immune. So we're not even close to herd immunity. And I think to think that we're going to achieve herd immunity through natural infection is not realistic, and certainly not realistic in the time frame we're talking about before the opening of school.
Thank you. And maybe one for Jason. And I guess I'm picking this one as much as anything because it's talking about vacations and trips, and it puts me in mind that actually we are in the summer and that there's opportunities for families to take a break. But one thing families are asking about is, normally without thinking they would take a trip to a hotel and stay in a hotel, or they would go somewhere where there's some degree of population. And a couple of people have raised how realistic is that? And B, and I've seen this as well, it's really difficult to get some of the younger children, our youngest children, to wear masks. It's not natural for any of us, and it's certainly not natural for sort of 3 and 4 year olds. And how should that affect whether people even go away or use transportation or any of those things? Is it just stay at home? And how important is it to really sort of get into a fight, if necessary, with your child, because putting on a mask is so difficult?
That's something I think everyone discusses every day with how to re-enter the world. And I think it's up to everybody to discuss with their immediate cohort or group or family what the risk benefit of each exposure might be. Everyone's going to have a different answer to that, to each scenario, based on their perspective. Going to the park, being out, as Dr. Hirschfeld said, being outside is far better than gathering inside. So if you're going to do something, do an outdoor activity. Go to the park. But as far as whether someone should fly, I can't comment on that.
Got it. Okay. I get. Go on.
Can I just mention something that I was having a socially distanced play date in the park yesterday with Jacob and a friend of his, and another Ramaz mom said to me, because we were discussing the challenges of mask wearing for young children, that maybe somebody should invent something like a spaceman helmet for them that would be more comfortable and yet protective. And I thought that was really pretty brilliant. And I hadn't thought of it myself, but I'm wondering if Jason, if you've heard anything about that alternative, because we know mask wearing is the single thing you can do that protects you, your child, and the community better than anything else. It lowers the risk of transmission out and in by between 50 and 80%. So it's really super important. And it's miserable, particularly in the hot weather. And I don't have a young child, but I can't imagine trying to mask a young child. I think it would be very hard. So I don't know if you've heard of anybody trying to make something more creative, like a spaceman's helmet.
Not that I'm actively aware of. You're right, it's that toddler group, that sort of nomadic, explorative group that is pushing boundaries. The babies you cover up in their carriers, their strollers, you face them inwards. But those 2, 3, 4-year-olds are going to be tough. The recommendation is for anyone over 2 to try and wear a mask. That is the official academy recommendation, and that's what we try to do in our office. And again, do your best. That's all I want. Just do your best in trying to wear your mask and socially distance. And mask wearing is the single most protective measure you can take. I agree with that.
Where do shields fit into all of this? We're beginning to see them certainly in some of the countries which have gone back to schools, or also in other environments. And I guess
I don't think for the general public it's a huge risk. That's more important if you're aerosolizing or giving respiratory therapies or getting really close to secretions in an intubation setting or an oral procedure. I think that if you can wear a mask that's clean and dry and socially distanced, you're going to optimize, or you're going to limit your risk.
Thanks.
Right, I agree with Dr. Perlman completely. The shield is really to protect the eyes, because the eyes are a really vulnerable spot. So if you're already masked and you put the shield over, that protects the eyes. But unfortunately, a shield by itself, and it was just a paper in the Lancet on this, a shield by itself doesn't work because the air can get under here and get into the nose and mouth. So, because, you know, for young children, that might be easier to wear, but you've got to protect this part too.
Great, thank you. And you mentioned it, Dr. Hirschfeld, and it's on a lot of people's minds, is play dates. As their kids, all of our kids are kind of lonely and isolated somewhat, even though they all love their family very much. They're ready to try something. What you talked about, outdoor play dates. Is there a benefit to sort of having one or two friends who you consistently have play dates with? Is that just a kind of hopeful thing rather than an actual thing? I'd love you both to comment on that.
Well, this is with my mother hat, not my doctor hat, but I guess my mother hat is informed by my doctor hat. So we were very late to the play date scene, but we have had now play dates with just two friends, but they're friends with whom I'm very confident that their families are observing the level of scrupulousness in their life that we are. And I think that one of the things about this that's so challenging is it requires having really frank conversations with people, because as Jason was saying, everybody is evaluating their own risk every day in what they do. You know, some people are going to the grocery store, you know, others aren't. Some people are dining outdoors, others aren't. Some people, I mean, you know, the list is long. You know, 2 months ago when everybody was in their house and nobody was seeing anybody, it was pretty straightforward what to do. But now different people are doing things in different ways. And so my own view is, and I think this is, you know, substantiated, is the smaller the number of people you have contact with, the better. So it's better to have more play dates with one, as you say, or two people. And, you know, I feel very strongly that children are overwatched by adults in general, but these days I think you have to just be watching them constantly, because even two really conscientious fourth graders need to be reminded perpetually, stay 6 feet apart, keep your mask on, you know, put your arm out. If your arm is out and his arm is out, you guys better be, you know, more than a foot apart in the middle. And, you know, that's how we've been doing it, only outside, because I think outside is also really protective. Jason, I don't know if you have additional thoughts about that, but
I thank you. The highlight of I think cohorting or limiting your cohort to more play dates with fewer people at a time is the way to go. I agree with that completely. And even as we open up the larger community, we're being limited a little bit at a time as to how many people together can gather. And I think that's a basic healthy approach that's pretty sound and proven.
Thanks. So another summertime question, because as I said, they cheer me up. Not going to ask you for direct advice, even though it has been sought by some. But what are the kinds of factors that people should think about as parents, given now that sleepaway camps and day camps are opening up? And you know, the couple of people have asked the question, what would you recommend? But I feel probably it's fair to ask the question, what are the factors that people should take into account, unless you feel comfortable making a recommendation? But I don't want you to feel under that. But certainly, what are the things people should be thinking about when deciding whether or not to send their children?
I think camp's great. I'm a camp dad, to be honest and forthright. I think it's important to review your camp policies and their approach. Each camp's going to be a little unique and interpret things a little differently and implement to the best of their ability. Disinfection and infection control procedures. So you want to review, are you comfortable with how they're limiting risk? And then if something slips through the cracks, what's coming home and who's potentially exposed. That's kind of the algorithm I try to run when I see my family, and knowing that I'm a healthcare worker and people are of various personality characteristics or physical characteristics.
Thank you. I don't know if you have anything to add, Dr. Hirschfeld, or just
it's just the same. You know, I don't mean to sound like a broken record, but it's a risk analysis. You know, what is the worst thing that's going to happen? And as Dr. Perlman said, kids don't typically get too sick or sick at all, but they can bring it home. And so is there somebody at home who's in a vulnerable group due to age or due to pre-existing condition? And you know, those considerations, you know, and certainly there are great benefits to camp. You know, camp is a wonderful thing.
Thank you. And on the subject of children, how it affects them, have you seen or learned much or have on this sort of Kawasaki syndrome, this concern that there is some variant that appears to be linked to clusters of where COVID-19, you know, there was a lot written about it. It's got a bit quieter now, but obviously it's on parents' minds very much.
Well, I can tell you, this is good. We can each hopefully stay with our roles here. We know that there's an inflammatory syndrome that happens after a period of infection. With what exact infection? That's been a holy grail of scientists for a long time. Initially with the Kawasaki disease. Kawasaki disease is a group of inflammatory symptoms like fever and rash and conjunctivitis and swelling of mucosa that has been associated with cardiac issues down the line if untreated. But what exactly prompts that inflammatory syndrome, we're not exactly sure. In the middle of a pandemic, we recognize that there's a number of children who have inflammatory symptoms that also are testing positive for COVID. So we know that it's associated, but we don't know that one is causal. That I hope Dr. Hirschfeld can speak a little bit more of. But we know that despite its aggressiveness or severity, unless the intervention medical care is offered, it's pretty rare. I think the recent review in New England said that there are only 185 cases nationwide that meet the true severe criteria, and so it's not benign. It's a very angry inflammation, and the children really don't feel very well at all. And it's not subtle, and it also happens to affect children a little older, not maybe 4 and 5 and up, more than the younger kids, which is something we don't understand either.
Thank you, Dr. Hirschfeld.
So, you know, just as Jason had said, this is a Kawasaki's like syndrome. Oh, I think, you know, and again, for anybody who's really interested, there were just 3 really good papers in the New England Journal yesterday. And so it's 185 cases have been reported nationwide. There have been 2 deaths. Most of the kids, even those who get very sick, get better with treatment. I think the really important thing is that early treatment makes a huge difference in the ultimate outcome. So it's not clear, it's associated with COVID, but it's not clear it's caused by that. 70% of the kids who had it were either positive for the antibody or positive for the virus, but that means 30% weren't. You know, so it's really a mystery, and it's unfolding before us. But also, as Jason said, the kids are really sick, but the symptoms are, you know, fever, really bad stomach ache, and an angry rash. And if anybody has anything like that, call your pediatrician, you know, right away, because getting early treatment really seems to be important.
Thank you. And there is some questions that have come in again, and I think it's obviously very much on people's minds, very much on my mind in terms of thinking about schooling, which, and I think you addressed it to a large extent, but this is the role of children in spreading COVID-19, even if they're not necessarily exhibiting symptoms of COVID-19, and what do we know about that from a medical perspective, or what don't we know about that from a medical perspective, and is the fact that it seems less likely to impact them related to the chances of it being spread by them, or are they really two different things to think about?
I think that they are really 2 different things to think about. So I think that the fact that children don't get clinically sick the way adults do, or most children don't, is just the saving grace of this virus, in my view. Unlike influenza, which disproportionately impacts children. So the fact that children aren't getting sick is great, and it reduces my anxiety every day, which always needs to be reduced ever more in these circumstances. That doesn't mean they're not infected. And so why they're getting infected and not sick is, I mean, there are a whole bunch of theories, and I don't think we have time nor interest to discuss them. It may have to do with a receptor issue. It may have to do with children having an immune system that's different. They still have a thymus that is making T cells. No, but the answer is short, nobody knows. But it is clear that they can carry the virus and they can infect others. And that's the reason that they need to be masked just like everybody else. And this gets to a really important point, not just for children, but at least 40% of people who are infectious and spreading the virus are either what's called asymptomatic or pre-symptomatic. So asymptomatic means they're not ever going to get sick, and pre-symptomatic means they're not sick yet. So people with this virus are most infectious before they actually have symptoms. So that's why, you know, the thermometer checks and the symptom checks, they're important, but they're only so good. And that's why the wearing of a mask, even if you feel well, reduces the spread. And so that's applies both to children and to adults. But the scientific and biologic issues of why children are getting infected are of great interest. And they're particularly of interest because they may be keys into figuring out ways of, you know, therapy, right? So if you could convert the adult system in some ways like a childlike system, so nobody got severe disease and death, that would be amazing.
Thank you. I'm going to ask Dr. Perlman a quick question, but also there's a nice easy question that came in for you both to think about. So I'll let you reflect on it, which is just the very straightforward is when are we going to have a vaccine and how effective is it going to be? So a nice easy question there, but joking about, but just a quick question for you, Dr. Perlman. What precautions should parents take when bringing their child to see a pediatrician for any regular illness or the dentist for that matter?
No, that's great. So I want to reiterate a point we touched upon earlier. Maintain your routine childhood visits and maintain those vaccines on schedule. That's maintaining your overall health is the best prevention against any infection. A very helpful way, most pediatricians are seeing well visits at one part of the day, usually in the morning, and then sick visits in the afternoon, and scheduling in such a way that you go right into the room where there's not, you know, there's 6 feet separation in the waiting room. The norm of a pediatric waiting room madness is very different now than it was pre-pandemic. Our toys are locked up. So you want to make sure that, especially if you have very young kids or someone's going to bring them that can't expose themselves, you want to make sure that they're limiting your exposure and that they're wearing, and that the providers and the staff are wearing masks and wearing gloves and wearing goggles so that they're limiting their exposure to themselves and to what they spread elsewhere from contact.
Thank you.
So the vaccine question is the question I wait for every time I do this, because the vaccine effort is absolutely amazing. There are 150 what are called candidates. So those are vaccines that haven't yet been approved in testing right now. In the United States, there are 3 now in human clinical trials. There are 2 in the UK that are already showing some data that looks promising. The other saving grace of this virus is it's a really good target for vaccine protection. So I feel quite confident, unlike HIV or TB or malaria, there will be a vaccine. And there will probably be many vaccines. The first vaccine we get may not provide the amount of protection that we would ultimately want, but it'll be a good first start. So the regulatory agencies everybody's just been like working like mad and speeding everything up. Typically it takes a decade to develop a vaccine. The shortest vaccine was developed in the early 60s in 4 years. And that is sort of considered, a world record. It has been a world record. The notion that there will be a vaccine by fall that works, I think that's overly optimistic. My own personal guess, and it's really a guesstimate, is that there will be a vaccine by spring, a year from March, say. But whether it will be distributed is another matter. So there's, the vaccine trial that shows that it works, and then there's manufacturing and distribution. And those are really, really protean tasks. So some of the vaccines are being made at risk. So the manufacturing facilities, rather, are being built at risk, and the Gates Foundation has stepped up and is doing that. And as many of you have heard, through Operation Warp Speed, the United States government is doing that as well. And that will really speed up the process. But there are certain things that just can't be sped up, like the human immune response. So, I liken it a little bit to baking a cake. If it usually takes, an hour to bake a cake, I can get one out of the oven in half an hour, but I can't do it in 15 minutes, no matter how many corners I cut. And nobody's going to cut corners on safety, but everybody's doing everything they can to move this along fast. And we don't have time now, but another time we can chat about, the various kinds of vaccines that are being tested. There's actually data, there's good immune data from some of the earliest ones in trials. There's wonderful animal data from those and some others as well. The regulators and administrators have been moving heaven and earth to move these things along faster. So I think that's a bright spot. But it's a little bit, like the idea of this too shall pass. There will be a vaccine and this will be over, but it's not going to be for September, and it's probably not going to be for January either.
Thank you very much. We were actually very fortunate in the high school. The CEO of Moderna, which I know is one of the companies that's working hard, spent an hour in Q&A with the students and gave us a real sense of the work they're doing and the speed that they're moving at. It was fascinating.
Now, if the Moderna vaccine works, that's one that's super easy to manufacture. So the DNA and the RNA vaccine ones are easy to manufacture relative to the other ones. So that will be available sooner. So that's a really promising one.
Thanks. I'm going to sort of ask you one more question and then a chance to wrap up, or you can do it in the context of the question. But what are we learning, or what should we be learning from Israel, South Korea, some of the countries in Europe that are beginning to open up, and we're seeing either a spike or nothing, or it seems to be working, or closures? And obviously I'm thinking schools because of my job, but that's true of restaurants, and that's true of life, like hospitals, non-essential, medical treatments and what have you. What are we learning, and are we learning anything which ought to impact decision making as we go forward? Jason, Dr. Perlman, I don't know if you want to kick off on that one at all.
I think we're learning how to best limit risk exposure. And I think that each person is going to decide for themselves, and those are responsible for determining to what extent they're going to carry out the harm reduction model, to keep the concept we keep bringing up, to limit their risk overall. Whether that means, play day with one kid, two kids, going out to have a coffee with somebody. That, again, please just understand that there are things you could do to limit your exposure and to limit those you expose to others, and to do your best to understand what the risk benefit of each exposure is.
Thank you. Dr. Hirschfeld.
So I think we're learning a ton. I think that, two things: the ability to exchange information and the willingness with which authentic information is being exchanged is unparalleled. We've learned about masks. At the end of February, the Surgeon General was tweeting, "Don't buy masks, they don't work." Now, why that was ever thought, that's another question. But we've seen in the countries without much other intervention that have, Japan, Korea, Cambodia, even Vietnam, which has a very limited public health system, but there's universal wearing of masks. There's been very little spread of the virus. So we've learned that masks work. We've learned, in Korea, I think 80% of the infections were associated with one super spreader event in a church. So we've learned about, singing, speaking, being in an enclosed area, all being, really risky behaviors. Who would think that? So I think we're learning things all the time. And as things work and then don't work, I think everybody's looking very carefully to try to, make a sort of best practices. And Jason, I agree with you that everybody's making their individual risk assessments, but I think we also have to collectively commit to do certain kinds of things as a community. And that, the mask wearing, and I realize I sound like a broken record, is absolutely essential. I think that opening windows is really important. I think that understanding, and this is another thing that we're learning, is that not only are all behaviors not the same level of risk, but all people aren't at the same level of risk. So we have to protect, and we haven't talked about this, and I know we're talking about schools, but what's happened with nursing homes and congregate care groups, it's been catastrophic. And how to do that better, there's a lot of data on that now. So I think that there are many lessons, and we've got to continue to learn them. And I think that informs, what we said at the beginning, is that we have to have a level of flexibility and a willingness to assimilate this new information into what we're doing that's really uncomfortable. And that might mean that school opens in some form or another, and then something happens and we have to close again. And that's going to be super hard. I don't envy you having to tell everybody that, Jennifer, but that may well happen. And we have to understand that that's sort of part of the natural order of this. And, the vaccine is on its way. There are so many therapies being tried. I'm really optimistic about that. And so this too shall pass. I just, you don't mean to sound like a broken record, but I think we have to be confident about that too.
Thank you. And in asking you just to wrap up, there's something that you said, Dr. Hirschfeld, just now about these communities where everybody has, whether it's Japan or Korea or Vietnam, where really everybody has bought in to what needed to be done. And Dr. Perlman, you mentioned it in a pre-conversation that we had, the importance of community buy-in, that anything that a school or a shul or a restaurant or whatever, anything a country does, where you both spoke about that, and I'd love, as we wrap up, for you to comment on that, because I think it's certainly made me think, and I imagine it'll make many people think.
I just, to reiterate, we have responsibility to the world around us. Tikkun olam. We have to buy in. You don't speed in the car just so you don't hurt yourself and the person you don't hit. You modify your behavior to help not only yourself but help others in the community. And if your child is sick this year, please quarantine them and don't expose other people who potentially could get really harmed.
Thanks.
Yeah, I think this is a time, like families, when communities are tested. And, we have to come together and support each other and protect each other. And not only protect each other, but protect our most vulnerable members. And so how we do that, is easier said than done. And as Jason has said, this notion of harm reduction, I think, is very appealing. Until we have a medical intervention, all of these social interventions have to be layered one upon each other. And it may mean things like, as Jason said, don't send your kid sick to school. And as frankly, as medical professionals, we have a long track record of, soldiering through, taking Advil, taking Tylenol and showing up. That's done. For the next year, your throat twitches, go to bed. You don't have to go to bed, but stay in your house.
Well, this is a conversation that's certainly based on the list of unanswered questions, which we will share with both of you, could probably go on for another couple of days. I guess I'm fortunate that I get the opportunity to carry on the conversation. And once again, I've learned so much, and everybody who's listened in, just your wisdom, your common sense, your expertise, your approachability, I think really gives us a sense of how it's all working, what we can do to make a difference, some of issues about the trajectory, and also some of the considerations which we have to take in this mixture of uncertainty and the anxiety that causes. Obviously it does, but also this too shall pass, as I think I can quote you saying that there is a point beyond all of this. I think there are important messages to take away. So